Hello, welcome everyone. Welcome to the Age-Friendly Communities Program Grant Information Session. We will be getting ready to go for 11 a.m. just as people are arriving. Welcome. And I'll do introductions as we have more people online. Thanks for joining us today. And again, this is the Age-Friendly Communities Program Grant Information Session. And feel free to introduce yourself in the chat, and you can indicate which territory you're joining us from this morning. And I'll do a land acknowledgement once we've got more people joining and we're ready to go. I'm assuming that everyone is very experienced using Zoom now, so I won't go over all the administrative details, but obviously there's the chat there, and if you have any questions, you can post your questions in the chat and the Q&A. And we have staff supporting the webinar this morning, and we will be taking your questions and answering those questions at the end of the webinar. So again, welcome to BC Healthy Communities Age-Friendly Communities Program Grant Information Session. We'll be getting started at 11 a.m. And again, as you have questions coming up, you can post those in the chat and the Q&A, and our staff will be monitoring those and they'll be answered at the end. I'll just give another 30 seconds for folks to join. Welcome everyone. BC Healthy Communities Age-Friendly Communities Program Grant Information webinar, where we will cover all the things you need to know to apply for our Age-Friendly Communities program. Okay, great. Hi, Christy from Harrison Hot Springs. Whoa, nice to see you join us today. It's great. All right, well, I am going to get us started. And again, welcome. This is BC Healthy Communities Age-Friendly Communities Program Grant Information webinar. So welcome. This is for our 2023 Age-Friendly Communities Grant intake and application process. And the grants are available for local governments and Indigenous governments across BC. Now, I am Jodi Mucha. I'm the Executive Director of BC Healthy Communities, and I'm here with my colleagues, Stacy Chappel, who is our Grants and Engagement Coordinator, as well as Alyssa Roehrich, who is our Age-Friendly Communities Program Lead. And I'll introduce those two later in the webinar, and they will go over the Age-Friendly Communities Program, as well as all the questions you may have and the information that you need to get started to apply for our grant program, our grants that we're offering. And there's lots of materials on the website as well, and we'll refer to those and post those links. And as we go, please do post your questions in the chat and the Q&A. So to start, I would like to acknowledge that BC Healthy Communities is located on the traditional lands of the Cossapsum and the Lekwungen-speaking nation, where we live, learn, work, age, and play. And for today, we anticipate that the presentation will take approximately 30 minutes. And following that, we invite you to stay for the question and answer period, where we will cover everything you need to know, any questions that come up about the application process for the Age-Friendly Communities program and the grants that we're offering for 2023. That said, you don't have to stay. We are recording this, so it will be available for future reference, and the link will be sent out as post-webinar materials for you, so you can always refer to those. And anything that we cover in the webinar is also posted on our website as part of the application materials and the application guide. So as I mentioned, we have our staff supporting this. We've got Stacy as our grants and engagement coordinator, and we have Alyssa as our program lead for the Age-Friendly Communities program. And we also have my colleagues Gurmeet and Monica, who are monitoring the chat, and they'll be posting links throughout as we go through the webinar. And again, if you have any questions, feel free to post them. And to start off, I'm just going to share with you a little about BC Healthy Communities. We have been around since 2005, and we're based on the World Health Organization's Healthy Communities, Healthy Cities approach. And we are a team of planners, public health practitioners, community engagement specialists, and communication experts. And our work is really at the intersection of planning and public health. And we provide grants to local governments and Indigenous governments across the province. And those grants consist of cash plus our capacity building supports. And we also develop a wide range of tools and resources that are available for the public on our website. So next slide, please. And at BC Healthy Communities, we also believe that it's possible, and it's not just possible, but it's necessary, that it's easy for citizens to be healthy and well. And it's very much a preventative upstream approach to community health promotion. And without further ado, I will hand it over to my colleague, Alyssa Roehrich, who is our Age-Friendly Community Program Lead. She oversees the program, and she is the person who will be working with you, providing capacity supports if you are a successful Age-Friendly Community recipient of the grants. So without further ado, I will hand it over to Alyssa.
Hello, everyone. It's really nice to be here with you today. Thanks for coming, and thanks, Jodi, for the lovely introduction. So the Age-Friendly Communities program works alongside Indigenous governments and local governments in building their capacity to develop policies, plans, and actions that create age-friendly communities. It supports partnerships across sectors for creating age-friendly communities and provides learning opportunities and leading-edge practices for collaborative and local action. So for some background information on age-friendlies, BCHC has worked closely with the Ministry of Health to deliver 2 programs under the provincial strategy of Age-Friendly BC. There was the Age-Friendly Communities Recognition Award Program from 2011 to 2016, and then the Age-Friendly Communities Capacity Building Program from 2015 to 2021. And as of 2022, we became the new administrative host of Age-Friendly program. So moving forward, I would like to touch on the Age-Friendly Communities approach. So what is an age-friendly community? An age-friendly community supports older adults to age in place. They help create policies and resources that provide environments for older adults to live active, social, engaged, and independent lives. The age-friendly approach considers the diverse needs of older adults throughout all phases of community planning and policy making. The age-friendly approach is most effective when local governments and Indigenous governments develop policies and services using the WHO's approach across the 8 age-friendly domains. So here we have listed the 8 domains from the WHO listed that have been slightly modified to be more inclusive. So the 8 domains of the age-friendly community are outdoor space and buildings, transportation, including safety, housing, social well-being and participation, respect, social inclusion and cultural safety, community engagement and employment, communications and information, community support and health and wellness services, At this point, I'll hand it over to my colleague Stacy to speak more about the age-friendly communities and grants and application process.
Thanks, Alyssa. Thanks, Jodi, and thanks to everybody for coming today. As Jodi mentioned, my role at BCHC is Grants and Engagement Coordinator, and I'm your contact for administrative aspects of the age-friendly communities grants, including the application process. So some links to the grants webpage will be posted in the chat, and you can also find these at any time on the BC Healthy Communities website by going to the Programs menu and Age-Friendly Communities. The Age-Friendly Communities grants offer two components to recipients. The first is cash grants, and the second is in-kind, customized capacity building supports provided by BCHC staff. There are two streams of age-friendly communities grants. Stream 1, planning, for completing an age-friendly assessment and developing an action plan, and Stream 2, projects, for implementing components of an action plan. I'll review the eligibility criteria today, as well as the application and adjudication process and some more details about the streams. Then I'll hand it back to Alyssa to talk about the community supports and share some examples of past funded projects for your information. This presentation is intended to give you an overview, but we do encourage you to review the application guide. This guide is available on the Age-Friendly Communities website, and a link is also being posted in the chat to the PDF. So the first question for any grant writer is, of course, are we eligible? And for the age-friendly communities grants, all Indigenous governments and local governments are eligible to apply for both Stream 1 and Stream 2 funding. So you'll see a list of the eligible applicants on the slide there. And if you're here today representing a nonprofit or another community organization that is partnering with an eligible applicant, the process is for the eligible applicant to be submitting the application as the lead and to list you as their partner. And then you can organize your work together. So a bit more about the grant streams. For Stream 1 planning grants, the funding offered is up to $25,000. Planning grants support the development of a local age-friendly assessment and action plan, and it can also include support for adding an age-friendly and equity lens to an existing plan or policy, or to a consultation to develop that other policy, such as your comprehensive community plan or official community plans, a reconciliation plan, framework, or agreement, or a community health and wellness plan. A full list of examples is available in the application guide. For Stream 2 projects, the funding offered is up to $15,000, and this stream provides funding to carry out one or some of the actions or projects identified in the action plan during the planning phase. Typically, to be eligible for Stream 2 projects funding, applicants are required to have completed an age-friendly assessment and action plan through Stream 1 planning grants. However, applicants can apply directly for Stream 2 projects funding if they provide an existing age-friendly assessment and action plan that indicates this was one of the recommended projects. There's many possibilities for the projects that you can do, and Alyssa will share some of those past funded examples with you after my portion of the presentation. For both grant streams, the grant comes with funding as well as supports for BCHC staff, and Alyssa will discuss that as well. So applications are submitted through an online web form. The deadline to apply is July 28th at midnight, and that's Pacific time. We recommend reviewing the application guide before completing your application, as it provides a lot of information about eligibility criteria and our program priorities that will help you make a stronger application. Every application has to include a project overview, a budget, a work plan, and a council or board motion to support the application. For the project overview, the web form is going to include questions about the proposed activities, goals, and outcomes, and that's how you show your overview. You'll be asked how the project will incorporate equity and your plans for evaluating success. And we have posted the application questions on our website so you can prepare your answers in advance of submitting your application through the web form. I think we're going to post that. It's also a PDF in the chat. The application needs to include a high-level budget. The budget should include the total project cost, not just the components funded by this grant. So other revenue sources, including in-kind contributions, should be noted. For Stream 2, the budget can include capital costs, such as equipment or building costs. but capital spending is capped at 40% of your AFC funding. So funding from this grant can only go 40% to capital. Your broader capital budget could be more. The work plan, like the budget, is a high-level plan just listing the major project milestones, as well as who is anticipated to take the lead for each milestone. There's an Excel template for the budget and work plan. It's a single file with 2 different sheets, and you'll be asked to upload that template during the application process on the web form. Finally, a local government council board resolution or a band council resolution or the equivalent for the government applying is required. And there is an option if the meeting is happening just after the application deadline, there's an option to report that and to submit it later by email. So all Stream 1 and Stream 2 applications must demonstrate a focus on one of the 8 domains of an age-friendly community that were mentioned earlier. And those domains are also listed in the application guide with some links to learn more about that. And in the application, you'll also be asked to identify which provincial government health promotion initiatives align with your proposal. And again, there's a list of those initiatives in the guide, along with some examples of projects that do that. It is optional, but it's strongly encouraged to include any supporting documents that you have with your application. So for example, if you're working with a partner organization and they have issued a letter of support, please do include it, as that will strengthen your application. We are aware that internet access can be a barrier and sometimes is intermittent for communities. So if using the web form to apply is not working, please contact me at grants@bchealthycommunities.ca. And don't worry, my contact information will be on a slide at the end. You can make alternate arrangements for submission. And similarly, in the web form itself, if file uploads aren't an option, there's a built-in option to submit by email to make that easier for you. A few tips throughout the application guide. And if I haven't said it enough, please do look at the guide. It will really help you. You're going to find tips in there on how to strengthen your application. All those tips point to the features the adjudication team will be considering in selecting successful projects. So in our adjudication process, we're looking for very specific things. We're looking to see that your proposal uses an equity lens. Is your plan or project making an age-friendly community accessible to everyone, especially those who need it most? Is your project focused on a group of older adults that has been underrepresented, or ensuring a specific method to include them in your process of planning or in the project? Tell us how equity is incorporated into your proposal. We like community-driven and flexible plans that are responding to the needs of the community, as expressed by those who reside in that community and those affected by the ultimate policy decisions. So if you're making sure to include those people in your process, your program, to hear their feedback, please describe that in your application. We are looking to see meaningful partnerships, collaboration with your health authority or with local community organizations across multiple sectors. The partnerships don't necessarily have to be fully formed by the time you submit your application, but if you are forming partnerships as part of your plan, include that in your work plan so that we know that's part of your plan. And if you have letters of support from those partners, definitely include them. So partnerships are a way that we think that we see projects and planning becoming more sustainable, but there's other ways that you could be making your project more sustainable. So if you have other ideas about how the benefits of your plan or project will extend beyond the granting year, please do share those ideas. We look to see that plans for evaluation and you have a plan for evaluation and measurement. So if you're going to be evaluating your work, please do include that information in the application. So for example, if you're going to be collecting data in surveys or through consultation meetings, how are you going to record this information? How is that going to work for you? How will it improve your work? Finally, we're happy to discuss your proposal with you. Feel free to request a consultation call to discuss your proposal in advance of submitting. You can email your questions to me at grants@bchealthycommunities.ca or just give me a quick call. We also compile the questions we receive, and we have created an FAQ page on the website. So that includes all the sorts of questions we got last year in this session and also on phone calls. And we've got those answered. So that is a quick resource for you as well. Okay, so a couple of the key dates as a reminder. The application date is July 28th, midnight Pacific time. We'll notify all the applicants of the result in late September. For applications that are selected, the start date for the activities is October 23rd, and the work is intended to be completed for 2024. So keep that in mind when you're building your work plan and your budget. You might have things happening before and after because planning processes are quite long, but this grant, we want to see the budget and work plan focused on that work period of October 2023 to November 2024 and the components that will be covered under that timeline. A final report, including a high-level budget report, is due November 2024. And the funding is issued in two portions, 80% at the start, once the financial agreement is completed, and 20% of the award amount is held back until the final report is submitted. So that completes my overview of the grant administration. And now Alyssa will come back to some examples of supports and past funding.
Thanks, Stacy. I'm here and I would like to give you some examples of age-friendly projects, keeping in mind that they can be quite varied in nature and depend on the specific needs of the individual communities. So some examples are senior housing inventory and gap analysis, library service for homebound patrons, increasing seniors' wellness through recreation, education, and inclusion, an age-friendly business initiative. And so more of these examples and past funded plans and projects can be found on the Age-Friendly Communities webpage. In addition to providing the cash grant, BCHC also provides in-kind customized capacity building supports. All grant recipients participate in an onboarding call where we introduce ourselves and talk about how BCHC may support you in achieving your project goals. Our role is to support your community in building capacity, and that may look like supporting your evaluation strategies, sharing resources developed by BCHC and others, helping design an engagement strategy, coaching or advising on specific areas, such as how to apply an equity lens to your work, review and give feedback on assessments, action plans, and other documents produced. These supports can look quite different because each communities have their own needs. So the application guide and the website give some more examples of these supports, and there's a link in the chat to the guide. So that concludes the presentation portion of the session. We thank you so much for everyone who joined us today. We really do appreciate the time that you have taken to be here. We highly encourage you to contact us with any questions that you may have about the application process or your proposed project before the July 28th deadline. You can reach Stacy through her email or phone number that's on the screen to schedule a call or to contact her with any questions that you may have. So we have about 15 to 20 minutes to go through some questions that we have, if we have any questions through the Q&A window. So we know some people may not be able to stay for the questions. If you have to leave, thank you so much for coming, and everybody else who can stay, please continue to add any questions you may have to the Q&A window. So we'll give us a few minutes for anyone to post your questions in the Q&A. Feel free to ask anything.
Okay, shall we get started maybe?
Yeah.
Or should we give people another second?
I do have one question here that we can get started with, and maybe more will start rolling in, if that sounds good.
Sounds good.
So the first question we have is for the question 15 on the application form. It asks for the activities as detailed as possible. Are these referring to the detailed activities of the work plan?
Yeah, so you could include the items of the work plan. You might provide a little bit more detail because the work plan is quite high level. So the work plan might say something like, hold a consultation session in January, and this person is the lead. It's just a spreadsheet. So it doesn't provide a lot of detail. So in the application detail, you might describe a little bit about how the consultations will be managed. So for example, things you might do to make them more accessible. Perhaps you're holding them in different locations around the community or in partnership with different organizations, that kind of detail. If they're being recorded and shared in other medium to make it more accessible online, that kind of thing. So yeah, just a little bit more detail on those items. And sometimes there might be multiple stages of that end up in one piece of the work plan. So the work plan is quite high level, and then that detailed explanation just gives us a little bit more of a flavor of how you will do that activity, and gives you an opportunity to describe some of the things that we're looking for in those application tips. So how you're considering equity, is there an evaluation method? How does it tie in with your goals or with the feedback you've received that have led to this, this process?
Awesome, thanks, Stacy. The next question we have is a council motion endorsing the creation of an age-friendly strategy sufficient if the strategy includes reference to the specific project?
Yes. Yes. So if the community has you know, recently said that, you know, we would like to create an age-friendly strategy and they've passed a motion directing that that would be done, that would be acceptable for the Stream 1 application. You don't have to go back and reintroduce that just specifically to this grant. We know that you might be applying for several grants for the one strategy process. We would be looking to see that it does mention age-friendly specifically in some way. So if you are doing an official community plan, you'd want to have something on there mentioning that it will consider an age-friendly lens.
All right, next question. Would a letter of support from a municipal seniors advisory committee be accepted?
Yes, letters of support are always a good idea to include. And I mentioned, I think I've mentioned that they could come from partners, but even if a group has been recommending that something be done and they want you to do it and then they're not going to be a partner on it specifically, that would be also a good idea to include. So any letters of support are good to include.
Those are all the questions we have now.
Actually, Alyssa, I see there's another question that's just been posted under the one you just read. You see that?
Okay. Yeah. All right. So our next one, it says the town has an age-friendly assessment and action plan that was developed in 2016 in partnership with a community organization. However, this was not adopted by council in 2016. Will this be an issue to apply for Stream 2 for an action item identified in the plan?
That's trickier, and I think I might want to meet with you about that one because it's not been adopted. So they have a plan that's not been approved. That's trickier. I don't know if Jodi, with her, she has more experience than me on the local government landscape.
I think we would have to check in about that. I mean, ultimately, the goal here is that this is an opportunity to leverage and influence policy change. So if there's an age-friendly plan and it's been adopted, then obviously it's kind of baked into what the municipality is doing and it's in line with the vision and the commitment. And then once that plan's in place in subsequent years, you can apply for projects to help to animate and initiate or activate that plan. I think if there's something that you could submit that shows indeed that there is an ongoing commitment to that, I think that could be something that we could consider. I'm thinking, Stacy, we should probably check in with our partner, the Ministry of Health, on that question just to make sure.
Yeah, they did have a follow-up question of, will a letter from the town's accessibility committee be acceptable?
You want
a letter from the
Stacy?
as a council motion from a committee? I think when we were, I think we might have to formally we might have to go check that one with our funder. I know in some cases, a committee is struck with a mandate, so it might depend on the committee's terms of reference. So if the committee has a terms of reference that indicates they have a mandate to develop, for example, the age-friendly programming and direction for the community, and then that committee has taken that initiative, it can kind of be a little bit of a governance pathway question. So I'd need to look at the details, but I think it's possible that it would be enough depending on the nature of the committee and the powers that it has within the government structure, because each local government is different, and each Indigenous government is different in how they structure their committees, sometimes just due to the size of the municipality. So I suggest we have a quick email conversation where we look at those things, and then we can confirm. We're not trying to make it a burden. We are, like Jodi mentioned, what we're trying to do is make sure that there is commitment in the local government to follow through. So if we can establish that, we're generally in favor.
All right, as of right now, that's all the questions we've had come through. So that's it for today. I just want to, sorry. Before we finish, I'd like to mention 2 more things, and thank you for coming. First, when you exit this webinar, a survey will pop up. We would really much appreciate if you could take the time, the few minutes, to just complete the survey. This will allow us to improve our webinars to better serve you. The second item is a simply reminder that we will send out a recording in a follow-up email with all the links from today's chat, with our application guide and any other resources that we had talked about today. So thank you everyone for joining us today. We really appreciate you being here. And we have our slide up here with Stacy's information. So we can reach out with any questions you may have. So
and just one thing I'd like to note as well, just as an opportunity just to squeeze it in. We have on the 28th, which is next week, we are hosting a webinar, and it's on healthy public policy, and it's all around how to create Indigenous partnerships to inform healthy public policy. And so it might be something that's helpful and useful for you as you're thinking about your age-friendly plans or program that or activities, that this webinar may give you some additional ideas for how you could better partner or initiate some partnerships if you don't have them already, or improve partnerships with Indigenous communities in your municipality and surrounding area. So it's next week, June 28th. We can send an information out with the follow-up info. And thanks for your commitment to building age-friendly and healthier communities for everyone.